Hi there. We'll be talking about tummy tucks today. It's a common term, lots of people ask for it. And sometimes they really need it, sometimes they need something more, sometimes they need something less. So when people come to us, they show us their abdomen, their belly, or their tummy, and ask us, do I need a tummy tuck? They want to reshape their abdomen. And the first thing we see is if there is any skin laxity. So the way we assess the abdomen is this. We see if there's skin laxity, if there's extra fat, if there's weakness in their muscles. Oftentimes ladies who've had babies would have some diastasis recti. That is when the vertical muscles of the abdomen, they separate and there's a space between them. Sometimes they even may be hernias. So we assess all that. We see the quality of the skin. We see how much of skin laxity is there versus how much of fat is there. If there is minimal skin laxity and some fat, we would not advise a tummy tuck. What we would advise would be a liposuction, a vaso liposuction perhaps, then tightening of the skin further with something non-surgical like thermi-tight or body tight. Those work well. There are no visible scars after that. And the small cuts with liposuction heal without much of a visible scarring at all. If, however, there is skin laxity once people have had babies or lost weight, have had this yo-yo kind of diet where things go up and down, for those people, tummy tuck would be advised. Now, who do we advise something different than tummy tuck, something or a different kind of tummy tuck? So a regular tummy tuck, the amount of skin that is removed goes from just above the belly button to all the way down to the pubis and to the hairline, and the cut is kept within the bikini line. So all that extra skin is gone. Now along with that, we can do some liposuction, some shaping, and at the same time we can tighten the muscles. So that would be an abdominoplasty or a tummy tuck. The belly button stays there. It's in the same position pretty much where you've had it before, but it now has to come out through a new opening because the skin around it has to be pulled down all the way down to the pubis. So it comes out through a new opening, and some people think it's a new belly button. Technically it is not. It is just putting it in a newer place or through new skin, so it looks nicer sometimes. Sometimes it needs some more treatment to improve the scarring around it. There's a very small amount of scarring that happens around it, and that can be improved as well. So that's a regular tummy tuck. Then we have something called endoscopic tummy tuck. Now, endoscopic tummy tuck is actually not a good term, but essentially what we do is we make a very small cut, and people who just have laxity of the muscles, there is space between the recti muscles, we tighten them through an endoscope all the way from the top to the bottom, which the endoscope can reach. Sometimes what we do is called a mini tummy tuck, which means keeping the belly button with its own place where it was before, not even cutting around the belly button, but moving the skin in the lower part and removing an ellipse of the skin in the lower part. So that tightens up the lower part. And sometimes there is very little laxity in the upper part, so it works well. So less laxity in the upper part, you can go for a mini tummy tuck. Sometimes with the mini tummy tuck, what I do is something called rectus muscle tightening when that is required. And for that I use a technique called floating belly button, where the tightening can be done all the way through and the belly button is reattached after everything has been tightened up. So that's called a mini tummy tuck with a floating belly button technique. So it does give all the tightness to the muscles and reasonable tightness to the skin as well, especially if the weakness is there all the way through, but the skin laxity is only in the lower part. So that is a mini tummy tuck with a floating belly button. Now, there is something called an extended tummy tuck. What the extended tummy tuck does is it goes farther than the regular tummy tuck, and it kind of tightens the muscles as well as the skin. It goes all the way down, all the way to the sides. So it extends the tummy tuck and improves the area of the love handles as well. And you can do it with liposuction as well, and then it would be a lipoabdominoplasty, but an extended lipoabdominoplasty would be even better to the sides. Then there is something that people call a 360 tummy tuck. It's not actually a 360 tummy tuck because the tummy is obviously in the front, but there is a 360 liposuction with it. So you can do 360 liposuction and then do a tummy tuck. So that is 360 lipo with a tummy tuck. But then there is something called belt lipectomy. Some people call it, wrongly so, a 360 tummy tuck. What it does is you have the all around like a belt, you remove the extra skin and tissues, and you would have tightness in the front and tightness in the back. Extra skin is gone from the stomach, from the sides, as well as from the lower part of the back, just above the buttocks. So that is extremely important for people who actually have lost a lot of weight and there's a lot of skin laxity. And it works really well for those people. It is not needed for the regular individual who just has laxity and some fat in the front, or a lady who's been pregnant, has had a few babies and the skin hangs down, has some stretch marks, and also has some space between the muscles. For them, it is best to have a regular tummy tuck or an extended tummy tuck, depending on the looseness of the skin, the extent of the looseness of the skin. So there's another question that was asked of us is there something called non-surgical tummy tuck? So technically, non-surgical tummy tuck is not really a tummy tuck. It would be skin tightening in the abdomen, and it can be done non-surgically. Perhaps the best way of doing it today is invasive radiofrequency. There are 3 machines I'm aware of and I use, a couple of them, and those are ThermiTight, BodyTight, or J-plasma. They're basically invasive radiofrequency techniques that go inside with a little needle or little probe. There is something on the outside, the temperature is monitored, and the temperature is raised, radiofrequency waves are given, and over time the skin tightens up to the point where it becomes reasonably tight and looks much better than it would be otherwise. I often combine it with some liposuction so that you get the tightness as well as removal of the fat, and some sculpting of the muscles, which a lot of people like. Another question that we are often asked is, how long does it take? Now, the measure of a surgeon's experience and training can be that he does it, the job, or she does the job expeditiously, does it well, and it is predictable. The results are predictable. People get a good result. The scarring, of course, is dependent on the person's own scarring, but in terms of tightening, in terms of safety and everything, a well-timed, faster tummy tuck for a person who knows what they are doing, who are very well experienced, generally works out quite well. However, someone who takes longer does not mean the quality of the tummy tuck is any less. It just depends on how they do it. And on an average, I'm just giving you an average, about 3 hours for an average person's tummy tuck is very usual. So between 2.5 to 3.5 hours, most people are able to do the regular tummy tuck. If you add some liposuction or 360 liposuction, that of course will add time. So think of about 3 hours, and most often people want to stay overnight. So most often one night stay, and the procedure takes about 3 hours. Little less, little more, doesn't matter. The morbidity does go up if people take many more hours. So if people take 6, 7, 8 hours, then there is an issue when you have to keep people maybe for a couple of days more and take extra precautions. But in general, within the limits of what most experienced people do, it really doesn't matter if it's in half an hour more or 45 minutes more or less. Now, another question I got asked was, is the tummy tuck procedure painful? And the answer is, it is painful as long as you do not take enough pain medications. So you need to take a fair amount of pain medications. Sometimes we give some patches for pain relief. Sometimes we give medications, and you have to take some medications on a routine basis. Meaning for the first couple of days, you take one medication, 4 hours after that you take another one. You don't stop. You don't want pain to reach a point where it peaks up. So you do cut it off before it peaks. So take regular pain medications at least for the first 3 days. After that, you can reduce the pain medications and also the type. You can go down to the regular NSAIDs, acetaminophen, ibuprofen, some combinations with paracetamol or with acetaminophen and tramadol. So those things can be added and combined, and after a couple of days, the pain becomes bearable with minimal pain medications. So make sure pain medications are taken, but the procedure itself becomes bearable with that. Some people ask me, is it comparable to the pain of a C-section? And actually it is not. There is a big difference. C-section, there is something done to the inside also. but you have a nice little baby after that. With this, you come in healthy and feeling great, and you're having a nice tummy tuck, and you end up with some pain. The quality of the pain is different because it's all on the outside. Now, very often we are using long-acting local anesthetics and blocks, which give you pain relief for several hours or a day also sometimes. And then you have to be very comfortable after that with pain medication. So between the blocks and the pain medication, it works well. The quality of pain is different from having a baby. And you feel really good after everything is done, but it does take a little while longer than after having a baby. You have a baby in your hands, you feel wonderful. You kind of forget the pain. But with this, there is pain. So anyone who says, "I will make it painless," it's not painless, but it can be made very, very, very comfortable for the person who's undergoing it. We are often asked, how long is the recovery after a tummy tuck? So depending on what you're looking at. So I'll briefly say what I tell people. And the first thing is, the recovery in terms of going around, walking around. And you should do that first day on. You won't be walking straight. You'll be a little bent up because it becomes tight like you've never had it before. So it's quite tight, most of the tummy tucks. And because of the muscle repair, you'll be walking a little bit bent over, a little bit, not completely. But walking from the first day onwards is important, not to get a clot in your legs and not to have other medical problems, which are basically related to having bed rest. So when you're in the bed, you should have your head up, your shoulders up. Make sure you do take deep breaths, cough, holding a pillow on your abdomen. When you are walking, you can take a little support if you wish, but walk. We prefer that people walk a little bit, maybe even 3 to 4 minutes to 5 minutes, a couple of hundred steps every hour or two when they're awake. Don't get up just to walk, but if you get up, you should walk. We often give pumps in the legs. They're like little stockings that will keep squeezing your legs so that you don't have a problem with the clots forming. But walking is always the best thing to do. Next comes the recovery in terms of sitting down and working on your phone, on your laptops or on your iPads, and that can be usually done after a couple of days. The third stage of recovery is when you have your attachments removed. If you've had a drain put in, like a little bulb, that is removed usually in 5 days or so. The next stage again is, when can I go out and have someone take me somewhere to the mall or somewhere to a friend or something. And for that, it usually takes about 2 weeks. You can do most activities in 2 weeks, nothing very vigorous, no vigorous exercising. But walking and visiting people or having people come by, that all can happen in 2 weeks or so. All the sutures are removed about the same time. And you feel much better once the sutures are removed and you're more mobile, you can do your stuff. A lot of people can go back to desk jobs in 2 to 3 weeks. And the last stage is, when can I lift weights? When can I do something really vigorous? For that, I say wait for 6 weeks. And then you can do pretty much all the exercises you wanted to. Start slowly, but you'll be able to start the exercises with minimal risk of having a problem. If you start lifting weights initially, the repair that has been done to your weakness in the muscles or the hernia, that can be a problem. After 6 weeks, start slowly and you'll be able to gradually get into everything that you like doing. Another question about tummy tuck is, does tummy tuck help with stretch marks? And absolutely, the amount of skin that is removed, those stretch marks are gone, and the others which are on the top, they get moved down. So which are up here will go down, and the ones that stay also get stretched out, so they look better. Stretch marks elimination to the point of where above the belly button is there can happen, and above that, if you still have stretch marks, they get stretched out, and they also look better afterwards. So stretch marks are helped with tummy tuck, and for small amount of residual stretch marks, there are other treatments that we do. But tummy tuck itself is probably the best treatment for the stretch marks, especially in the lower part of the abdomen. Common question about tummy tucks is, do we need to do a muscle repair? And depending on how much muscle weakness is there, how much the muscles have separated, we can choose to do limited muscle repair, no muscle repair at all if it is not that separated, or we can do a full muscle repair where the the muscles have really been widely separated. And again, the techniques can be either just suturing, which is what we usually do. We hardly ever need a mesh, but occasionally we can need a mesh, and then the mesh works out well also. But it is very rare. As I said, maybe 1 in 100 we could need a mesh. But other than a very occasional individual, mesh is almost never needed. And 1 in 100 where we need it is usually a hernia, not just a weakness in the muscle. So repair of the diastasis recti, which is the muscle which have come abroad, is a good idea most often. When there is no weakness, you don't need to do it. Now the next question about liposuction is liposuction included? Now some liposuction is often necessary, but when we do a lot of liposuction, we kind of have a different code for it. And you do either a 360 all around liposuction or just the sides and give some definition to the muscles. That is very often the case. Liposuction with or without tummy tuck goes, the technique is pretty much the same. The definition that we give is pretty much the same. But when we do a tummy tuck, liposuction is done before we do the actual excision part. And we are able to give a better definition and a better curve to the sides when we do it with a tummy tuck. So a lipoabdominoplasty or liposuction with a tummy tuck is a great idea for people who need it. Now, how do you choose the right surgeon for a tummy tuck, like any plastic surgery or cosmetic surgery procedure? And I think the three things that I look at, one is the training, where did they do their training, and basic degree or basic board certification in plastic surgery, if they did any additional cosmetic surgery training, and where did they do that. Their years of experience. Usually a more experienced surgeon tends to give a more predictable and better result. And thirdly, how often do they do this procedure? Is it an occasional procedure, or do they do it very often? If they do it very often, you can see some pictures before and afters, and must make sure the pictures are honest. And also maybe talk to a patient or two, because a lot of people don't want to talk about their cosmetic procedures, but an occasional patient will. And you can get an idea as to what to expect. More than just the quality, you can know something about the recovery and so on. Please do not choose the plastic surgeon based on choice alone, based on reviews on the net alone. Do not choose them based on the cost, just the cost alone. So you have to have all these criteria that we've talked about. You have to check all those out before you choose a plastic surgeon. Cost is one criteria, but it should not be the only one. Should the shininess of the office be a criteria? You have to have a nice, clean place where people are courteous and they listen to your problems. But it doesn't have to be, with the ladies which have the best makeup on, or they have all had plastic surgery. So it should be nice and welcoming, the atmosphere, clean, and the doctor has to be a thorough professional, well trained, well experienced, someone who does this procedure really well and does it fairly frequently. A question that is quite common for tummy tuck is, can I have it as a part of mommy makeover, where there are other procedures that are done? And absolutely, most of the time we can do the breast and the abdominal procedure for a mommy makeover together. So most of them can be done together. Some liposuction, tummy tuck, breast lift, or sometimes reduction, they can all be done together. So yes, you can do it as a part of mommy makeover. Am I going to have visible scars? And the scars are usually all within the panty line. So you can put on even a two-piece swimsuit and you'll be fine. We may need some scar management, make sure that we can decrease the scarring, but it can be taken care of. And very rarely someone wants a little tattoo, like a little grapevine, and that is not a bad idea. Most people should not need it. The scars do take a while to mature, and sometimes the best scarring takes about 1 year, but it looks pretty good in a few weeks. Sometimes people ask us, is it okay to have a tummy tuck before completing your family? And sometimes the situation is such that they're really desperate to have a nice looking torso, a nice looking abdomen, and they don't want to have kids for the next several years. And then it is okay to do it, although you may have to have the skin retightened or some more excised after the babies, because things expand after having babies. So, you can have it done and look great for several years before you have the babies, and then perhaps, not always, perhaps you may need to have a little retightening done. having babies is not a problem after tummy tuck. So it can be done. Usually we prefer that you have completed your family, and after completing your family, you do your tummy tuck. But it's okay if you need to have it done, and you know that several years, 3 years, 5 years, 6 years before you want a baby, and you've lost a lot of weight, things are hanging down, it's okay to get it done. Question we get asked very frequently about after tummy tuck is, am I going to lose weight? The answer is you will lose weight from all the liposuction and removal of the extra skin. It's not a weight loss treatment, but you do end up losing some weight. How much will depend on how much loose skin and the weight of the tissues that are going to be removed, including the fat, the liposuction fat. Are tummy tucks permanent procedures? Once done, you're done. And most often that's the fact, that's the truth. Once you're done, you should not need it again. Your skin remains tightened. If you don't have babies, if you don't have huge amounts of weight gain, you're done. And once you're done, it's just have to take care of basic diet and exercise. Nothing unusual. And you'll have permanent results or long-lasting results. Aftercare of tummy tuck. So I got asked these questions, and they're wonderful questions by someone who's getting it done. And I'm going to go over them. The first thing is arnica good? Now, arnica is a homeopathic medicine, and a lot of us don't believe in homeopathic medicines, but arnica works well for swelling. And in that situation, using arnica tablets is very good. We've seen it help. There are studies which prove it. It may not be our system of medicine, but it does help. So we routinely prescribe arnica. Another thing I got asked about the post-operative care is, how do we clean the wounds? Should we keep alcohol pads? And that's fine. You can use alcohol pads. Although after 48 hours, the skin itself is closed. The superficial layer of skin heals up and it closes. So it's not essential, but keeping a little bit of alcohol to wipe the areas is a great idea. Especially around the drain. They'll have a little pipe that comes out to drain all the fluids, and you can clean around that with a little alcohol pad or even with liquid alcohol. Next question was, do we need hibiclens or antimicrobial soap? Doesn't hurt, especially before the procedure. You can wash your body. When you take a shower, you can use hibiclens or you can use an antimicrobial soap. Afterwards, not as much. Again, in post-operative care, one common question is, does vitamin E help? And it does help. It is a very good lubricant. Sometimes we advise people to put other things on, like hydrocortisone to decrease the inflammation, sometimes retinol or retinol A to increase the cell turnover, silicone gel sheet to improve the scarring, and there are a bunch of other things that can help. But the specific question was vitamin E, and it is helpful. It is not magical, but does help. Another common thing after having any surgery is constipation. Because of anesthesia, things slow down. And having some cremephene or milk of magnesia or Metamucil is a great idea. So how do we prevent deep vein thrombosis, which is a devastating complication in the legs if it happens after any major procedure, especially after tummy tuck? So what I do is, unless someone has pre-existing problems, the first thing I do is I have DVT pumps, which are like little stockings, little things that inflate and go down in your legs throughout the procedure and till the time you are with us, usually 24 hours or so, that they'll be in your legs. That is the time for maximum occurrence of vein thrombosis. So that is avoided. Subsequently, we do give people some low molecular weight heparin like Lovenox, and that helps as well. If someone is prone to these problems, then we do these things longer and we do more of it. So what do we do for scarring to improve the scarring after a tummy tuck or even other procedures? The first thing we do is ask you to keep things clean. Then we, till the sutures are removed, we ask you to we give you some simple ointments to apply, like hydrocortisone to decrease the inflammation. We have some certain dressings that we put on. Then we ask you to put silicone gel sheets. They're like plastic sheets that you can put on, or they're called scar strips also. You can put those on, and those help a lot over the next few months. We also give ointments like retinol or retinol A and hydrocortisone. But besides that, sometimes we use vitamin E, sometimes we use A and D ointment as well, depending on what's needed. After that, we ask you to massage your wound, your scar, which is forming a scar. The massage is kind of like this, not like this. So if this is the scar, this line, then you go like this. So, try to move the scar over the underlying tissues, not your finger over the scar, but the scar itself over underlying tissues. And that helps a lot. Sometimes we also ask you to do lymphatic massages or have someone do them for you. Sometimes there are some machine massages. Those help with swelling, not as much with scarring, but they can help with internal scarring, not the skin scar, but internal scars, which are inside the skin, all the skin that has been moved. They can keep that part soft. Some people like using silicone gel, the liquid gel for the scars with silicone, and that works fine as well. We prefer the solid silicone strips, but the gel itself works well as well. So even the solid one we call silicone gel sheet, but then there's the liquidish that you can squeeze out of a tube, and that works well as well. Sometimes we ask people to keep pressure garment on, not just for the contouring, but also to improve the scarring. So that helps as well. There are other less documented, less well-studied things like essential oils, aveno oil, and things like that. And they may help. I'm not sure if they do, but most of them do not hurt. So usually we let people check with us. This is what I'm thinking of. Can I put it on? And unless it hurts, I don't mind people putting on essential oils and things like that after the first several days, not right away. So another thing is the pressure garments. We usually prefer to have people put on pressure garments for 2 weeks regularly after the procedure, and after that off and on, meaning you keep them on for 2/3 of the time, and you can take them off after that, or keep them off for 1/3 of the time. Sometimes we also give some foam inserts, and we request you to buy some fahas, which are insert with a little bit of shape, and they'll keep the compression even better than just compression garments, and those help. So if you want to buy them, if you want to go that extra mile, then you can buy some of them. Those are available easily online, and we'll put some samples so that you can choose which ones you want when you come to us. We'll let you know which ones work best, and you can choose the ones that you like. Now, massages and ultrasound stimulation and lymphatic massages, they all work. They improve the swelling. You get nicer results short term. Long term, they don't make that much of a difference. But short term, those are nice things to do. If you want to take that extra care of your procedure, please go ahead. Now, what are the preparations you need at home when you go back home after a tummy tuck? Well, having a recliner is really good. And also, the head of the bed should be able to be angled. So what I often advise is putting a pillow beneath your cushion. Beneath the cushion you put a big pillow, so that you have kind of an incline going like this. So 45 degrees is the best. But if your back goes up, that's even better. But most people don't have a hospital bed at home. So this thing works, and having a pillow just behind the knee, that works well as well. So you can have those at home when you're there. Someone prepares for you, just like once you've had babies, your husband prepared everything for you. You can do it, and if you're the man, well, someone else can help you at home, or do everything before you come for the tummy tuck. Diet after tummy tuck. The diet after tummy tuck, a little bit of extra protein won't hurt, will help. Otherwise, normal diet is fine. Again, you may want some more fiber, some stool softener required. Stool softener because of the small amount of period of constipation, a couple of days of constipation that you may have. So use a small stool softener, have some more fiber in your diet, more vegetables, and a little bit of extra protein. This is not the time to diet, not for the first couple of weeks. You may feel a little bloated because things are tight now, but it'll be okay in a few days. Another question about tummy tuck was, what kind of sutures do we use? Well, there are usually 3 layers of sutures. The ones on the inside are dissolving. With different times they dissolve. Sometimes we put some that will take a long time to dissolve, up to 3 months. Some of them dissolve over the next 3 weeks or so. And then we have a top layer which is of non-dissolving sutures or staples. I usually prefer sutures. They cause a little bit less scarring. But some people prefer staples. There are some reasons to put staples on, skin staples, and we put them occasionally. Some people say, well, I prefer them because they come off easy or whatever. And the advantage of staples is that by chance, if there's some secretions, well, you can pop just one staple and let it out. But the sutures overall work better than staples for tummy tuck and for most cosmetic procedures. For reconstructive, I almost always use staples, where you're doing flaps and you're putting in, improving the skin somewhere by removing parts of the cancer or something. But for cosmetic procedures like this one, sutures are much better. Another question, tummy tuck with drain or a drainless tummy tuck? Both can be done. We sometimes use fibrin glue when we are doing drainless tummy tuck, and then we quilt the skin, which means we make it really tight, the junction between the skin and the muscles lower down, and that way you can avoid a drain. Drain sometimes act like a safety valve. If something builds up, it lets it drain out. But generally, it is something that can be avoided. But I would prefer to use it if someone really does not want it. Then we do a drainless tummy tuck. Take some extra precautions. Use some fibrin glue, which is available commercially. It's just something that we kind of inject all around where the tissues have been opened, and that works out well as well. Now, how many times do you have to visit me or any of the plastic surgeon who does it? Usually I see you the day after the procedure. Then on the 5th day, where if there is a drain, then we'll pull it out. Then we see you on the 14th or the 15th day to remove everything, all the sutures and everything. So those are the minimum ones. So someone who's coming from abroad, someone coming from another state, those are the 3 visits that are almost mandatory to make sure that everything is nice and safe. And then you go home all recovered, in the basic recovery period is gone. We do advise a few things at every visit and answer all your concerns. So I've tried to cover the topic of tummy tuck quite comprehensively, but there will be some other questions that will come up, and feel free to ask them. We will give you a link down below. You can ask any questions that you have. Check out your doctors. If you have any questions that can be answered online, we would love to do that for you. If there is a question in terms of logistics, how long and how much time to take off, depending on your work and depending on what kind of activity you want to do, we'll tell you exactly what would be the appropriate amount for you. So please feel free to ask us any questions that you may have.